Hello, Corey. My name is Kaylee. I'm going to be the nurse taking care of you today. What brings you here today?
Checkup.
A checkup, okay. Well, I'm going to be assisting the doctor, helping him do the assessment and just making sure I don't find anything abnormal, okay?
Okay.
Can you state your full name for me?
Kaylie Lindsey.
Okay, and where are you at right now?
The clinic.
And what year is it?
2014.
Great. That would mean he's alert and oriented ×3. As I walked in, he's very nicely dressed. I don't have any malodorous smells. Had some shoes on. Everything looks great as far as his mental status. All right. We're going to go ahead and move on to assess your skin, your hair, and your nails, okay? As I look and just inspect his hair, it looks nice and shiny. As I feel it, feels nice and soft. Everything looks intact there. I don't see any areas where there's any hair missing. His skin feels nice and warm. And as I'm going down and feeling and inspecting, I'm looking for any deformities, any moles that might be of concern to me. As I go down his arms, I'm looking at his hair pattern. Everything looks okay. I don't see any areas where there may be some hair missing, which would indicate a decrease in circulation. Skin feels a little rough, which, do you work outside?
Yes.
Definitely indicates that he does work outside. Skin turgor. Bounces right back, good sign of hydration. Veins are popping out in his hands, another good sign of hydration. Looking at his nails, let me go ahead and get your nail angle here. Go ahead and get it up. Okay. Looks like a nice 160 degrees. Nails are smooth. No indication of clubbing, don't feel any ridges. Capillary refill is less than 3 seconds. Good indication of some good circulation. We'll go ahead and move on to the assessment of your heart and cardiovascular system now. Can I get you to lay down here? I'm going to go ahead and cover you up with the sheet. Maintain your privacy. Okay. First thing I'm going to do is go ahead and inspect the chest. I want to see if there's any bony deformities, anything wrong. I kind of did that assessment while I was doing his skin assessment, making sure there's any abnormal moles. Sometimes with skinny individuals, you can see the point of maximum impulse, which is mid-clavicular line, 5th intercostal space. It's a little hard to feel Mr. Lindsey's intercostal spaces. Okay, feeling the point of maximum impulse right now. Okay. Also, while I'm doing this, I'm going to go and make sure there's no tenderness to his chest. Do you have any tenderness to your chest while I palpate?
No.
Okay. I'm going to go ahead and move on and listen to his 5 areas of his heart. Okay, first area is going to be 2nd intercostal space, just right to the sternum, which will be the aortic valve. I'm going to go ahead and listen with the diaphragm. It's a little easier to feel his intercostal spaces skin to skin. As I'm listening for these heart sounds, I'm listening for nice, even, regular heart sounds. Nice S1 and S2. Good lub-dub sound. Sounds very normal. Okay. Second place we're going to go to is left of the sternum, 2nd intercostal space. And that's going to be the pulmonic valve. Again, regular, nice hearing S1, S2. Good lub-dub. Nothing abnormal sounding about that. Third point is going to be 3rd intercostal space, tricuspid valve. Sounds nice. S1 and S2 sound nice and normal. Good lub-dub. Next area is going to be Erb's point, 4th intercostal space, just to the left of the tricuspid valve. Good S1, S2 sounds, nice lub-dub, sounds nice and regular. Next thing I'm going to palpate for is fifth intercostal space, mid-clavicular line, point of maximum impulse, which is also known as the apical pulse. I'm going to take this with my diaphragm for a full minute. Okay, looks like about 62 beats per minute. Normal is between 60 and 100. As I did that, I finished that, I would go back through and listen with the bell of the diaphragm at each point. Aortic, then pulmonic, then tricuspid, Erb's point. And last one is also the mitral valve. I don't think I mentioned that before. Okay, we're going to go ahead and move on to your respiratory now, okay? I'm going to go ahead and have you swing your legs around. As I'm doing this, I'm going to go ahead and look at Mr. Lindsey's rate, depth, ease of respirations. Go ahead and just breathe normally like you normally would, okay? Maybe a couple deep breaths in between. Okay. Chest is rising and falling symmetrically. Looking at the diameter of his chest. It's a little wide. He is a non-smoker. The reason why it's wide is the excess adipose tissue. Okay. As I'm looking at this and he has bare skin, I'm also going to look for any bony deformities, anything that might make him have a hard time breathing. Okay. But for now, we're going to go ahead and move on to palpating his chest wall. Okay. I'm going to go ahead and palpate for any kind of tenderness. Okay. Next thing I'm going to do is thoracic expansion. Okay, Mr. Lindsey, if I can have you take some deep breaths. As I'm assessing this, I'm making sure that his chest wall is rising and falling evenly. All the way up his chest wall. Which feels great, nice and even. Okay. Next thing I'm going to do on his posterior chest is go ahead and palpate for tactile fragmentus. Mr. Lindsey, if I could have you say the number 99 over and over again.
99.
As I'm doing this, I'm listening for vibrations, or I'm sorry, feeling for vibrations,
99.
making sure there's no differentiation between sides, and it feels even all around.
99.
Okay. Next thing I'm going to do is go ahead and move on to percussion of his posterior chest. This is going to indicate whether or not I feel any masses or anything, any deformity that I might find. I'm going to move in a ladder position from right to left. Over the lung fields, it should sound resonant. Over the ribs, it might be dull. If I percuss over any masses, it's also going to feel dull. A little hard to do this on Mr. Lindsey since he has a little bit of excess adipose tissue. Okay, we're going to go ahead and move on to inspecting and palpating your anterior chest. Okay, let's go ahead and lie down again. Inspecting this, I'm going to look at what I did before, making sure he can breathe nice and easy while laying down. Chest rise and falls symmetrically. Go ahead and take some deep breaths. Okay. Going to go ahead and test for his thoracic expansion while lying down. Mr. Lindsey, go ahead and take some deep breaths. Making sure once again that his chest wall is nice and symmetrical. Okay. I'm going to go ahead and palpate for tactile fermentus. Once again, Mr. Lindsey, I'm going to have you do the number 99. Again, feeling for vibrations, making sure that everything feels nice and even. If there's any variations, it could indicate a deformity. Okay, wonderful. Going to go ahead and do percussion again. Once again, moving in a ladder position, right to left. And try and get in the intercostal space as much as I can, which again should sound resonant. Okay. And while he's laying down with the anterior chest, since we just laid him down, I'm going to go ahead and auscultate now with the diaphragm of the stethoscope. Again, moving in a ladder position from right to left. Take some deep breaths for me, Mr. Lindsey. Nice, smooth, easy breath sounds. Heard all the way through inspiration and a third of expiration. All right, Mr. Lindsey, let's go ahead and sit up and let's listen to the posterior part of your chest. Again, moving in a ladder position while I listen with the diaphragm of the stethoscope. Deep breath. Listening for a full breath. Again, nice low-pitched, even sounds. Heard all the way through inspiration and a third of expiration. Okay. Mr. Lindsey's respiratory system seems to be in good working condition. Okay. We're going to go ahead and move on to the vascular part of your body. I'm going to put it in semifallers. If I could have you lay down. There we go. All right. At first, I'm going to go ahead and inspect his jugular veins and carotid arteries. Go ahead and look to the left for me there, Mr. Lindsey. I'm going to look for any kind of jugular vein distension, which you might see a little bit in this position. However, when I go to lay him down, there should be none. If we do see that, then it might indicate some congestive heart failure, some cardiac disease going on. Let me inspect your left side. Go ahead and look straight ahead. I'm going to go ahead and lay him down. Okay, go ahead and look to the left. All right. Looks great, nice and smooth. We would also measure jugular vein pressure at this time too. Looks straight. All right, moving on to palpating all of your arteries. First one's going to be your carotid. I'm going to do one at a time, simply because if we do both at a time, it might cause the patient to pass out, and we would not want that, or have a vagal maneuver there. Nice, brisk, non-bounding, non-threading, feels nice and regular. Let me compare the other side. Feels the same, normal and brisk. Non-threading, non-bounding, nice and regular. Moving on to the brachial pulses. Okay. Feels great, nice and regular, and even on both sides. Radial pulses feel great as well. Next artery we would test would be the femoral artery, but of course we're not testing that in front of anyone. Okay, Mr. Lindsey, I'm going to have you swing your legs around, and I'm going to check your popliteal pulses and the bottoms. As I'm coming down here, I'm also inspecting his legs, making sure there's no hair missing or patches missing. That would indicate poor circulation in his legs. And let's see how his arteries feel. Nice and even on both sides. Normal. Nice and brisk. Moving down to the posterior tibialis. Those pulses feel nice and even, great on each side. And last but not least, dorsalis pedis. Nice and even. Great brisk pulses there. Now I'm going to check for the sensation on the bottom of your feet. If we could just put your feet back up on the bed there. We're going to do this by testing with a cotton ball and a paper clip. Mr. Lindsey, if I could have you close your eyes. And I'm going to have you tell me whether or not you feel something soft or something sharp, okay? All right. And then what foot it is on.
Soft right. Sharp right. Sharp left. Soft left.
Okay, great. Past that with flying colors. Moving on to the gastrointestinal system. I'm going to go ahead and lay you flat again, okay? Sure hope you're not getting dizzy with all this up and down. First thing I'm going to do is, of course, inspection. With that, I have a light here to assist me. I'm going to look at his belly. If his belly was exposed, I'd be looking for pulsatile masses, which he has a thin white shirt on. In his case, where he has some excess adipose tissue around the midsection, if he had a pulsation that I could see, I'd be very concerned. However, if the individual is, say, my size, and you saw that, might not be so concerning, just because that would kind of be a normal finding that you could see the pulse in the stomach, okay? We're also going to look for any scars the individual may have that would indicate any past surgeries. Of course, someone comes in with abdominal pain, it might be a small bowel obstruction or something like that, so definitely inspection is a big part of the GI system. All right? We're going to go ahead and move on to auscultation. As him being someone that was familiar to me, I do know that he does have a appendectomy scar and a cholecystectomy scar. Okay. When we go to do the bowel sounds, we section it into 4 sections. We're going to do first, second, third, and fourth quadrants. I'm going to go ahead and listen to begin with the diaphragm of my stethoscope, and then go back and listen to the bell of my stethoscope. You should be hearing 5 to 30 vowel sounds per minute. Which normally, right as you lay the stethoscope on, you should be able to hear that. If the vowel sounds are hypoactive, you need to listen for a full minute at each quadrant. Which Mr. Lindsey has some good bowel sounds, good peristalsis there. How have your bowel movements been?
Great.
Okay. At least once a day?
Yes.
Great. Moving on to the second quadrant. Third quadrant. And fourth quadrant. Okay, then I would go through and listen with my bell. When I listen with my bell, this is the best indicator of any kind of bruise you may hear. That sounds like a swooshing sound that would indicate an aortic aneurysm. It's a very distinct. I've heard it before, something that you'll never forget. Almost sounds like when you put your stethoscope on a fistula. All right, I'm going to go ahead and auscultate the arteries that are in the abdomen. I'm going to start off with the aorta. No swooshing sounds heard. Sounds great. Renal arteries. Don't hear of anything bad there. Iliac arteries. Should be directly by the iliac spine. Nothing heard there either. And then the next thing would be the femoral arteries, which of course we're not assessing for this assignment. Okay. Next thing we're going to move on and do is go ahead and palpate. We can do, there's light palpation, moderate palpation, and deep palpation. So we're just going to lightly palpate around. As I'm doing this, Mr. Lindsey, just let me know if I'm hurting you at all or if there's any areas of tenderness. Anything there?
No.
Okay, moderate. Anything there?
No.
Okay, and then deep palpation. And as soon as I'm done this, I'll be palpating for the liver and spleen. Okay. As I palpate for the liver, this might be a little difficult with Mr. Lindsey's adipose tissue around his midsection. All right, dear. Take a deep breath. And out. Okay. I cannot feel it. All right. I'm going to do the same thing for this side for his spleen. Ready? Deep breath. And out. Okay. Cannot feel his spleen or liver there. Okay. Moving on to percussion. As we go and percuss his abdomen, any hollow areas like his epigastric area are going to sound like a tympani. If you hear dullness, that may indicate a mass, which would not be good. Again, we're going to move in a systematic way to where this works a little better on bare skin, I do have to say. Okay, I'm going to just show you how to palpate for his liver. Moving up, it's going to be in the mid-clavicular line, so right down this way. And as soon as the sound changes, that's where we'd mark the bottom edge of the liver, which would be about there. Okay? Then we would start from the top, and when the sound changes from the top or starts to become a little more dull, then that's going to be the top of the liver. Okay, seems like the lines are right here. As long as that's between 6 and 12 centimeters, and that's the normal size of a liver. Now we're going to percuss his thoracic expansion. This helps us with the spleen. Something there of your stomach area. Okay. Seems like his spleen is right there. Okay, Mr. Lindsey, we're done with our assessment now. Is there any questions you have for me today?
No.
All right. Thank you so much for listening, Dr. Poff, and hopefully I've made you proud.